Hi, I'm Leschly, CEO of Bluebird. Welcome to Bluebird here. You can see that we have a thriving company here in Boston. What we're focused on is doing gene therapy for severe genetic diseases. These are for lethal diseases of children where we use something called gene therapy, and we use a virus to insert the gene that's actually not working. Sounds high tech, and that's because it is, but it has real high potential to have potentially curative effects on these lethal diseases. Now, the company's been around for some time, but the major investment with the help of Third Rock Ventures and a number of other venture groups here in the Boston area and globally have helped support the company starting in 2010, including Genzyme was an early investor, and we now have 100 plus people working at the company and are thriving as a public company most recently. And so over the last 3 years, we raised over $200–300 million to support the effort of what we do, since it's not exactly cheap. But what's been really helpful is this ecosystem here in Boston, having us be able to find the best talent from around the world and recruit the best talent into this area, given the thriving nature of this ecosystem, if you will. So hi, it's Leschly again here, standing in our lab where we do all our work. This is where we actually produce the virus that does all the work for us in the context of being able to insert the gene for whatever disease we're going after. And the diseases that we're going after are terrible, but multifold. One is called Adrenoleukodystrophy, or ALD for short, which is a terrible lethal brain disorder of children, where in there we're able to insert a transporter gene that allows them to clear some proteins that they otherwise can't. We also go after other diseases that are more well known, like thalassemia and sickle cell disease, where you can't produce functional blood, also on a global basis, a terrible, terrible disease. And there we insert a functioning copy of the hemoglobin gene that allows you to have a functioning blood system. In both cases, it's a one-time treatment to potentially cure these terrible diseases, which is in line with our transformative vision and objective here at Bluebird. So one of the things that's really exciting is we're pretty late stage with some of the programs that we have, trying to lever the platform that we've built. Platform because we think of gene therapy as a therapeutic modality. In the case of thalassemia, we recently announced in Milan at a big hematology meeting some very exciting data in the first 2 patients that we've treated with the new product, a new and improved product, and we were happy to see an amazing transformation very rapidly in these patients. These are patients that are dependent on transfusions of other people's blood to stay alive, and within 2 weeks no longer required any transfusions because our construct or our product was producing enough blood. But very exciting and late stage. And as we think about the next 6, 12 months and then multiple years, how do we do this in more patients, and how do we do this in more diseases? How do we think about oncology, where we have a big program with Celgene, where we're working on some very important treatments to work your T cell, your immune system against cancers. Very exciting area, and how do we expand that and other things that we're doing into other diseases? That's the future of Bluebird, because our whole objective here, and the only way we measure value, we call it True Blue, is our ability to impact patients and our ability to transform the lives of patients that have been handed in very unfortunate situations.